doesn't take long to find out, that people have a hard time managing hair and scalp disorders. Oftentimes, they're almost mysterious to people.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Dr. Shari Hicks-Graham. Dr. Hicks-Graham is a board-certified dermatologist, founder and owner of Downtown Dermatology, and also the founder of Live So. Thank you, Dr. Hicks, for joining me. It's such a pleasure to have you on.
Thank you so much. It's really a pleasure. Thanks for having me on, Janelle.
Yes. So I'm excited to talk to you. You're here in my city in Columbus, Ohio. So it's always good to talk to others that are here doing amazing things in Columbus. But tell me a little bit about, how did you get into dermatology? How did you choose dermatology in the first place?
Yeah, so I was a medical student at the University of Pittsburgh School of Medicine. And it was not until my fourth year in medical school that I had my first experience with dermatology. So I grew up with a physician dad who told me in passing, I think when I started my third year, hey, you should really look at derm. Derm, I think, would really suit you. I know a dermatologist in town. He seems like he has a really balanced life. And, you might just like to check that out. So I said, okay, Dad, but, in the busyness of the schedule, getting surgery, peds, internal medicine, OBGYN, all the requisite courses, dermatology really didn't come to me on my schedule until like December of my fourth year. And so at that point, it was really, really late in the game. I was already committed to internal medicine, pediatrics, kind of tracks for interviews, et cetera, for residency. But when I had my derm rotation, I knew right then that that's what I wanted to do for the rest of my life. I loved it. It was just so exciting to be able to use my visual skills and be able to formulate a differential diagnosis of things that potentially the patient was suffering from, and to be able to use that knowledge to convert right into something that could help with a patient's. I like the fact that it was procedural and that you could do a blend of like both medical, surgical, and cosmetic treatments. And so it was just a really exciting thing. I like the fact that you could treat men, women, all genders, all ages. I just thought that it was really cool. And also see kids too. So I love seeing teenagers in my practice. And so haven't looked back since.
That's awesome. So what was it in dermatology that really just pulled you in? Was it more the cosmetic side, or did you like just addressing all of the other skin concerns?
I really liked the whole thing. I really did. It definitely was not just cosmetics, although I love offering that to my patients. But really, it was just about being well-versed in both understanding the medical side and being able to intervene surgically when necessary. Obviously, skin cancers happen. Cysts, even though they are annoying, they happen, and oftentimes they need to be managed surgically. And certainly conditions related to the hair and the scalp often require small surgical procedures or cosmetic interventions, et cetera. Lots of medical procedures are required in dermatology. So it's really the blend, the variety, the day-to-day occurrence where really you're not seeing the same day twice. It's extremely variable. And I think that helps prevent burnout, I think, in our specialty. Burnout is such a big deal in medicine in general with physicians. And so I think with derm being so varied on a day-to-day basis, that's why I love my practice. I've really been able to serve a wide variety of patient population in terms of the types of things that people come in from, whether it be acne, moles, skin cancer, rashes, psoriasis, eczema, you name it. If it has to do with hair, nails, and skin, we help people with it. So it's super cool.
Yeah. I feel like you're kind of known for hair, scalp issues. When did you learn that there was a gap in how skin conditions were being treated, especially for people that have textured hair?
Yeah, so it doesn't take long to find out, that people have a hard time managing hair and scalp disorders. Oftentimes, they're almost mysterious to people. And it really is something that, especially since COVID, a lot more people understand that like hair loss happens. I think just stress can exacerbate it, and certainly so can having COVID. Oftentimes there's this post-viral shedding that people experienced at higher rates during COVID. And so now people are aware. But before that, 20 years ago, 30 years ago, when I was in my residency, I learned that there were some unique things around, especially the experience of Black women and hair loss. And really anyone who suffers with hair and scalp disorder oftentimes goes through a lot of mental anguish around this. And so it became a real interest of mine, I'd say from residency on. And so the moment I began practicing in Columbus, I noticed that there was a little contingency of patients who found me, and they said, hey, you're also a Black woman. Perhaps you'll understand what I'm going through with my hair, because oftentimes just the weekly care of textured hair, really it supersedes ethnicity and race. Really, it's just a hair type issue. If you have curlier hair, if you've got thick hair, in many cases, it tends to be drier. And so the typical care routine of washing it multiple times a week just is not suitable. And so if you're dealing with a scalp disorder and you have to use medications topically, a lot of the shampoos just aren't going to be enough necessarily. And so there have to be some special ways that you treat hair and scalp disorders beyond just like a medicated shampoo. And so just figuring out those nuances can really make a difference in the way that a condition is treated and the way patients thrive. If you understand, first of all, that if you can't give an individual that doesn't wash their hair more than once every 1 to 2 weeks a shampoo to use every day, then you're not going to get anywhere. But if you understand that nuance, you probably will have a patient for life.
Yeah, it's like getting to know your patients and what their lifestyle is, along with their hair type. I think that makes a huge difference. But now we see so much online about different products and, oh, you should use this. And, coconut oil is bad. And, there's just so many different things that we see. It makes it so conflicting. What is some of the biggest concerns that you see from patients coming into the office from, are they bringing in stuff that they're seeing online? Well, I heard that I should do this. How do you help that? Some of that?
Yeah, I mean, I think a lot of it is there's just so much information and people just don't know really what to believe. Mm-hmm. And so I like being able to kind of help people cut through the noise and really focus on the individual's issue by establishing a diagnosis. I think that's really important. I always tell people that if you're having a hair and scalp problem and you think you know what's going on, then sure, do your best, find something, you don't have to spend a whole lot of money, but try to find like a good first start toward a solution at the over-the-counter level. But if after a few weeks, or certainly if you're starting to lose hair and it's just not improving after, a few weeks, or certainly anytime anything hurts or is painful or just not resolving, then you really want to seek medical care. And it really should be with someone who understands and appreciates and likes treating hair and scalp disorders. I recommend seeing a board certified dermatologist who likes that. And, usually that'll be a good first step, and it'll end up saving you a lot of heartache and time in the long run.
Mm-hmm. Have you ever partnered with any like cosmetologists? Because if they're going and getting their hair done and maybe they're like asking their hairstylist a question, how are they directing them to a dermatologist?
Yeah, in many cases, I've built great relationships with lots of stylists, cosmetologists in the community. And in many cases, they want the best for their client. This is someone who they've worked with for years. And oftentimes they're the first ones who are noticing like, hey, I see something different. This is not normal for you. You have a spot here. Did you know you were losing a patch of hair in the back? Maybe you didn't know. This is new. You're shedding a lot more. What medicine are you on? Did something change? How is that family situation affecting you? Well, I see it in your hair today. So oftentimes they are our patients, first line of defense. They're seeing the issue firsthand. And so oftentimes we will get people who say, hey, my hairdresser referred me to you. She said that a client of theirs saw you and that you helped them. So I'm hoping you can help me too. So yeah, I find that they often are valuable allies. And I have built good relationships with folks in the community who I trust, and I also reciprocate, and I will send people to them because I know that they will take care of my patients.
Yeah. Yeah. I was thinking about this too, because I have my cosmetology license, and, I did hair years ago, not as much anymore, not other than family, but, as a cosmetologist, you sometimes are that first line. So it would be nice to connect with some dermatologists in your area to get to know them and to understand, how to recognize certain things that you need to refer to a dermatologist.
Oh, absolutely. And I've held classes, for continuing education credit that we've actually gotten approved through like the Ohio State Board of Cosmetology so that they could actually spend time and get credits, their continuing education license, et cetera. Because I think that's really important. It can't be that we're just telling the patient, but I believe in sewing directly, professional to professional. I don't know that they feel the most appreciated sometimes by the medical community, but I am here to tell you, we definitely appreciate the time and the effort that cosmetologists put into taking care of their clients. I've had cosmetologists recognize melanoma on their client's head, and if they hadn't spoken up, their client may not have had that skin cancer recognized it early enough. And, it really can make a difference. So I definitely believe in sewing back.
Yeah, absolutely. Most people don't automatically think, let me go to a dermatologist for my hair. So do you think that patients are surprised about their scalp issues and that they're referred to see a dermatologist?
I know. I think things are changing. I think in the media today, because of podcasts and articles and, other resources online, I think, people are learning a little sooner rather than later that perhaps their dermatologist may know. And if they don't have a derm, they may ask their primary care doctor for a referral. But yeah, I think people are learning that if they are concerned enough, they might want to get in to see a dermatologist sooner rather than later. So I do feel like I'm seeing people at an earlier point in the disease state. And I feel like that is making a real difference. And that's very important for conditions that are inflammatory. Inflammation and time kind of multiply, and that can equal lost time with hair. And, it can make a real difference in terms of the potential for hair regrowth. So the sooner the better.
Yeah, absolutely. As far as like hairstyles go, is there certain, styles that you're seeing a trend in that people are doing that are causing hair loss or causing issues that they probably should not be doing with their hair?
Probably the thing that I see the most is tension and tension-based hairstyles causing inflammation, and that inflammation leading to scarring hair loss. So I think it's really important to be careful if you're wearing your hair in ponytails or braids, that they be in a more relaxed manner so that they're not super tight. If you're getting a hairstyle installed that is tight to begin with, or it makes your scalp hurt, then it's definitely going to cause inflammation at the root of the hair. And that inflammation could potentially cause a cascade of effects that will eventually lead to you losing your hair. And it may not happen the first time, but certainly the second time, that scalp could have memory and it could just trigger something that you don't want. And so I think tension is really important. I think it's important to also be careful with how often you're using chemicals. Generally speaking, we recognize that color plus those tension-based styles can lead to hair breakage. Same thing goes for chemical relaxers or hair straighteners. You have to be very careful about those. And of course, anything that has a strong formaldehyde releasing chemical is not recommended. They can be very dangerous, and they kind of come and go and kind of in favor. They come on the market with different names, and basically it's like there are straighteners that aren't relaxers but are like long-term straighteners or smoothers. You have to be very careful about those. And then just combining products in any way is also kind of something to look out for. So yeah.
So I remember back in the day when I used to use relaxers on my hair and my sister's hair, we didn't know any different. We didn't know that they were bad. We didn't realize that they had formaldehyde in them. And, but I do remember, after a while, I'm like, okay, this can't be good for my hair because the smell is so strong. And then I think my sister's hair, probably when we were younger, it probably broke off. I
Yeah.
remember doing hers one time and I was like, okay, we can't do this ever again.
Yeah, yeah. I mean, you get a little notification, right? Your
Mhm.
body will kind of share with you, like, oh, that felt sore. My head felt tender for a few weeks after having that done. And you might get away with it once, but like the next time, it could be all bad. Or if, you have sensitive skin and you use, classically a color or just some sort of product on your scalp that then causes you to have like an allergic contact dermatitis. The first time may be like itchy. The second time could be devastating. And you could end up having like an inflammatory reaction that would lead to hair loss. And it can be devastating. So I think today the challenge is matching like your expectation for your cosmetic appearance with what's realistic. And I think that unfortunately there's such a high bar for women these days and men too, but certainly for women to be like Instagram ready all the time or whatever, and it's just not fair. We hold ourselves to these standards and I worry that we're going to end up paying the price for it long term.
Yeah.
So that's
That was,
kind of my
yeah, I
caution.
was going to ask that too. Like, what is the comeback from, having different issues that potentially could cause some hair loss? Like, what are some of the things that you're teaching that, okay, this is what you need to start doing now? Or if this happens, where do we go from here? You've got this hair loss. Is this something that's going to be permanent? What are some of the treatments that have to be done to be able to kind of thicken your hair back up and
Yeah.
regain some of that hair loss?
Well, I think it's just a matter too of just making sure that we don't dissociate from like what it is that we're trying to accomplish cosmetically with our appearance. So, for example, if it's braids or hair extensions, weaves, etc., those styles where you have added hair, I mean, they're such a time savings for people. And if you're in a role, either professionally or just socially, where you feel like you have to look done at all times and you have to be camera ready at all times, those styles just afford like a lifestyle that is just, it's hard to beat. It's hard to beat because you literally wake up and you're done, right?
Right.
And so I think it's kind of a slippery slope. So you have to kind of go into it understanding how you're going to get out of it. Okay. So like if you get those styles, it's like, well, tell yourself that this may not be something you can do forever. Like what's going to be the off ramp? So it's almost like begin with the end in mind, first of all.
Mm-hmm.
And then second of all, have a strategy for maintenance. So my recommendation, no matter what, is if you have a drier hair type, coily, curly, whatever, no matter what, you should still try ideally to shampoo every 1 to 2 weeks. Okay. So if you got your hair in a style that's very elaborate or it was very costly to get and you planned on keeping it for longer than that, then that's going to be kind of a challenge, right? So if you get it, when it's time to change that style out, my recommendation is to not go right back into a style that would require you to take so much of a gap from your regular care. So you probably want to go back into a simpler style so that you can kind of catch up and get your scalp back together. Really, it just focuses on basic care. Like, don't forget that, you're a person underneath with a hair and scalp that needs to be taken care of no matter what it looks like on the outside. Mm-hmm. And I'll just say that if you know, it may not apply to everybody, but if you're in that bucket where that is your lifestyle and how you take care of your hair, you know what I'm talking about. Mm-hmm. And so I think that that's the first thing is just, don't forget that you are worth taking care of and just, the basics, just keeping it back to basics. So that's one thing. And then, of course, again, it just focuses on the diagnosis. There are lots of different things that we can do medically or with day-to-day care to help bring the hair back. Topical minoxidil, oral minoxidil. If it's something hormonal, oftentimes it's, something that is coming because of like the change in life or what have you. If hormones are causing female pattern or androgenetic alopecia, there are ways that you can manage that. So there are, 20 different types or more of hair loss. And so really it's all diagnosis driven. And then there are some unique things that we can do as well, even in the regenerative kind of manner where you're using, things like platelet-rich plasma to inject and help stimulate hair regrowth. On the far end of the spectrum would be like a hair transplant. So hopefully we can catch things way before then. And there's so many like very exciting new things that we're learning about hair loss and ways to manage that would hopefully prevent all of that.
Yeah, absolutely. So I did have one question about like some of these younger girls, because my daughter has had braids before, but now it's, you've got some of the hair that they're braiding in. There's concerns about their hair thinning, like around their hairline, but then also there's so many chemicals in the braiding hair.
That's right.
There's a company that I saw, it's all natural hair and it's supposed to be really good, but it's really expensive and they've been out of stock for months.
Yeah.
So it's like, what are those options, or what should we look for, especially in our young girls? Is it affecting their hormone, their hair growth because we're putting them in these braids?
Yeah, I think the answer is we don't know. But what we do know is that the chemicals in the braiding hair are often not good. There was a study in Consumer Reports that showed that many of these products do release volatile organic compounds. Okay. And that's basically just like, emitted gases, literally, that are just expelled from these fibers that make up this synthetic hair. Imagine just having something that is like designed to be like a utilitarian object that you like carry around with you so close to like your nose and your mouth. And, even stylists, sometimes when they're braiding, I mean, this, you may get that in your mouth, you're inhaling it constantly. People are, you're carrying it around your face. So it's not good, these chemicals that are released, and that we don't really know what it's doing, but we know that it's not good. And I believe that some of these chemicals have even been found in the bloodstream later when they look at people. So these things are, probably having an effect. We can't directly give cause and effect yet. We don't know enough, but it is just important, I think, to know that the braiding hair could be a cause for contact dermatitis, most definitely. Mm-hmm. And certainly if it's installed with a degree of tension, it could absolutely affect the integrity of your hairline. And interestingly, there are even studies that show that chemical sunscreens have been associated with hair loss around the frontal hairline. And so it's also been recommended by some experts that we stick with mostly mineral-based sunscreens to help reduce our risk potentially of that. So these have all been like associative studies, or correlations, not necessarily cause and effect, but it's enough evidence at this point that I do not recommend using anything but mineral sunscreens at this point.
Yeah. I mean, it's good to be aware of that, that way you can make those sound decisions. Yeah. So speaking of products, LiveSo, tell me a little bit about LiveSo.
Oh my gosh. So LiveSo's my baby. So yeah, LiveSo was purely born out of the need that I saw in my patient population. So people were coming to me a lot in the early days of the practice, really complaining about hair and scalp issues. And one kind of unifying theme in many cases was seborrheic dermatitis, or dry, itchy scalp, basically like dandruff. Mm-hmm. And so if you had an individual with thicker, drier hair, I found that it was hard to coach them through a routine that was like effective, but also easy to use and not damaging on the hair, because a lot of the prescription shampoos were just really harsh and would dry out the hair. And so I created a solution to help people manage their dry, itchy scalp without drying out their hair, and something that was going to be cosmetically acceptable and pleasing to use. And so that's how LiveSo was born. So it's designed to help people have a healthy scalp and beautiful hair at the same time.
Wow. So what all products do you have? Is it just the shampoo?
There is a moisturizing shampoo. There's also a moisturizing conditioner, and then there's a moisturizing scalp lotion.
Okay.
Because like I said, it's not always practical to have the ingredients just come through on a shampoo day. You might need a step to kind of help carry the effects throughout the week. And if you're not shampooing again for another 7 days, I wanted to leave people with something that they could use between shampoos. So that's where the moisturizing scalp lotion comes into play. So people like that a lot. And yeah, it's been on the market since 2017, and we sell mostly on Amazon and livso.com, and also in dermatology offices around the country, and certainly here in mine. But yeah, it's been a great ride, and we have a lot of support from loyal customers and patients who have tried it over the years. So it's been really fun.
That's awesome. I didn't realize that it was sold all over.
Yeah, we still do sell it through our website. You can buy it even if you're in another country, but it was a lot easier in the days past with Amazon, but now it's pretty much just Amazon US.
Yeah, I like the idea of the lotion because I feel like a lot of times you get these oil-based products that are just greasy and nobody wants to keep putting it on their scalp every single day. So
exactly. And the oils actually can make seborrheic dermatitis worse. And so that's not anything I wanted to contribute to. So it's a very lightweight moisturizing scalp lotion.
Okay, that's cool. So how do you think that other dermatologists can do a better job at serving patients with kinky, curly texturized hair?
Yeah, so I think most of it is just kind of being aware and not being afraid to broach the subject. First of all, just knowing that no, like the hair cannot be treated the same way perhaps as a straight hair type. And so I think just kind of acknowledging one's own bias is important, and just educating oneself. There are lots of really great resources through our American Academy of Dermatology, and then there have been entire journals dedicated to skin of color education and research, and there are whole articles about like how to take care of, best practices for taking care of patients with textured and coily kinky hair. So I think it's just up to us as professionals. If you want to serve your patients well, you have to know how to take care of them.
Right. Yeah. What about those barriers when it comes to on the patient side? Do you think there's still barriers in access and education when it comes to what products to choose and how to find good products or what to do with your hair?
Oh, absolutely. I think there's a lot of like lore that's passed down kind of generation to generation. And It's funny how like just old habits die hard, and how things that aren't necessarily good for us come back around, and they seem to come back around faster than the things that are good for us. But I think like one great thing that's happened has been just the advent of like the natural hair movement. And so a lot of individuals have moved away from chemical straighteners and are embracing their own natural hair. And a lot of that is due in part because of, heated tools. If you want to wear your hair straight, you can straighten it without needing to chemically relax. And then also the products have gotten better at just like helping people extend the life of their straightened hair if they want to wear it straight, or even better, if they want to wear it textured. A lot of the products now really help to make the ease and work of styling natural hair easier or better. And I think that's where, just that nuance comes into play. I know I do allow doctors, residents, students to rotate with me when they are, in training as dermatologists. And so I welcome anyone with a sincere interest to come and visit and kind of learn, because you may have to step outside of your comfort zone a little bit and meet folks where they are. That was going back to the prior question. I guess there are lots of things, though, that people learn about like taking care of their own hair. And I think that with the natural hair movement, fortunately, people are learning, okay, it's okay to wash your hair more frequently. It's actually good, not bad. But sometimes I have to get back to people saying, well, isn't it bad if I wash my hair, I'm going to over dry it and this and that. And the fact is, it's not. We have to become a little bit more flexible in our thinking that, it's not about the style. Like the style is there to serve you as the person. We are not there to serve the style, right?
Right.
So we have to make sure we care for our hair and our scalp so that we can continue to serve styles. You know what I'm saying? But we have to make sure that styles that we're choosing are in service of our being.
Right.
and not the reverse.
Yeah. I think a lot of people never think about scalp health.
Yeah.
I don't think that's anything that's ever really been talked about. Now we're starting to see, some of the head spas popping up. And so that's kind of focusing more on the scalp health, but nobody really has ever talked about that. And even in cosmetology school, that was never anything that we were focused on. It was just styling the hair. So yeah,
Right.
it's a whole different thing that we have to think about.
Right. No, absolutely. Absolutely. We have to. And I guess I just see it so often that, I think that's part of the reason why I cut my hair. I've been like very short for a very long time just because, CCCA does run in my family. That's the short word for centrifugal cicatricial alopecia. And so that does run in my family. And I think I just got paranoid and I just didn't want to have to worry about it. I knew I wanted to wear my hair natural. I just cut it. But that's not for everybody. That's not for everybody. And styling natural hair is hard. So a lot of times these, notions about what's good for the hair, what's bad for the hair, they come and go. But I certainly try to answer questions but make it reasonable for people. I'm not going to tell people, all braids, all weaves are bad. It's just that you have to be balanced and you have to remember that your hair requires care. You can't forget about it.
Yeah. So what is the difference between hormonal hair loss and what is it? Androgenetic alopecia?
Yeah, they're basically the same.
Okay.
Yeah, so androgenetic alopecia is just like a synonym for hormonal hair loss, in my view.
Okay. And which affects women only or both
No,
men?
it can definitely happen for all genders. Basically, it's just when the androgens begin to kind of take over the testosterone-like hormone. So frequently it happens in women during menopause or men if they're particularly sensitive to their testosterone, which is occurring naturally. So sometimes that can happen in younger men or men as time goes on. But certainly women approaching menopause, and with that being such a hot topic right now, people are finally actually considering menopause and its changes on the female body. And so certainly hair thinning is something that can be part of that. And it can be scary and depressing, and people want to know what to do before it's too late. And so that's a time when we really can help. But it's about, like, again, making sure that we get the right diagnosis. So in addition to, listening to the patient, understanding what's happened, the time frame, what was going on, around that time, before, after, did they have surgery, did they have a baby, did they start on new medications, all that, did they have, an illness? We get all those history points together. We do a thorough clinical exam, and then in many cases, we will even recommend a little test called a scalp biopsy, where we can take a couple of samples from representative areas of the scalp and have them tested just to make sure we understand what is going on and that we have the data behind it to back it up. And usually by the time people get to me, they want that. They don't want to guess. They want some certainty. And so we work with our pathologists and we get a good diagnosis from those things.
So there's a way to be preventative, kind of.
Yeah. And take care of it early. And it's a lot easier to take care of it before it's a problem and when it's still in its early state.
Yeah. Okay. That's so good. So what is next? What is on the horizon with LiveSo or just in general in your practice?
Oh gosh, we're always looking for ways to kind of meet people's needs. I have my eye on a few new devices on the cosmetic front. People want high impact and low downtime. So I'm trying to balance those things for people. We have a good time. I mean, it's a really great life. I love what I do. I love working with two amazing physician assistants in the practice, and they take care of patients alongside me every day. And they're excellent clinicians and professionals that give care here in the office. I also work with a medical esthetician who's absolutely wonderful. So yeah, we're just here. We keep showing up every day and the phone rings and we show up and they show up and it's good. But we are continuing to press boundaries and give patients more of what they want from a medical and health standpoint along with cosmetics.
I love that. Well, thank you so much. This has been so enlightening and such a good conversation. I think that not a lot of people have heard a lot of what we've talked about, and it's good to get that information out there. So if anyone is looking and wants to book an appointment to come see you, come talk about their hair or any other dermatology conditions, how can they find you? How can they reach you?
Yeah, you can reach us on the web at columbusdowntownderm.com. It's like, what's the website? Yeah, columbusdowntownderm.com. There's a button that says message us, and you can reach out and request an appointment there. You can also follow us on Instagram at Downtown Dermatology, or you can call us at 614-224-4566.
Thank you. I'll make sure that we add your link to your website in the show notes as well. But thank you so much, Dr. Hicks-Graham. It was such a pleasure talking with you.
Thank you so much.
Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.